morning or good afternoon as it is in Seoul, I believe.
Wow, it's a 7 a.m. early in the morning. Thank you very much for joining us here.
It's 6 a.m. here, actually.
It's
quite early. So
earlier.
This is the earliest I've ever had to get out of bed for a medical tourism conference. So that's a first for Seoul this year.
Okay, just fresh start. So please start your presentation. Thank you in advance.
Certainly. Thank you. Good morning and good afternoon, everyone. My name's Keith Pollard. So I'm a healthcare specialist working for a company called Lang Buison. My particular interest is medical travel as publisher and editor of the International Medical Travel Journal, but also research consultancy into the medical travel market, and a lot of reports and information about that sector, and obviously things like our annual IMTJ Medical Travel Summit. So that's the day job. What do I do at the weekend? Well, this is what I used to do at the weekend and how the world has changed. So, at a weekend, my son races cars. So in the normal world, I'd be off to watch him race cars at the weekend. I run a very big youth football club with about 1,200 kids playing football. On a weekend, I'd normally be going off to watch them play. But of course, the world has changed and they don't play football anymore at weekends. And if I wasn't there, I'd be going to see a big game in the Premiership. And of course, my club and my favourite player is this guy, Heung-min Son. If you ever meet him, if he ever comes to Seoul, he is the best ambassador you have ever had for your country. He's done a magnificent job of putting Korea on the back pages, the sports pages of every newspaper in the UK and across Europe. So remember what an ambassador this young man is for your country. What I'm going to do this morning is to share with you my thoughts on what COVID-19 has done to the medical travel market, to look briefly where we are now, how it's impacted healthcare provision, patient flow, patient perception, the changes that it's driving in patient communication, and so just some initial thoughts on the way forward and where Korea might sit in this new kind of post-COVID world. So where are we now? Well, it's very simple. This is a global pandemic. This has affected more people around the world than either of the world wars that have taken place. So no country has escaped this. Some countries have managed it better than others. This chart here just shows the impact. The darker the color, the more deaths there have been per million population. And some countries have obviously suffered much more than others. And in Europe, obviously, we're going through a particularly hard time at the moment. If you go back to March, at the end of what's been described as the first wave of this pandemic, the travel and tourism business was fairly hopeful about when borders would open, when people would start to get on planes and fly. And this is what they're kind of three scenarios they painted back in March. Of course, all these predictions have been completely wrong, and even their scenario 3 it's worse than that. There has yet to be any recovery in kind of general travel and tourism, and at the moment there is little light at the end of the tunnel. I thought I'd give you an idea of what it's like in the UK at the moment. And the UK is fairly typical of what's happening across Europe at the moment. Excuse me. So across Europe, every country across Europe is being hit very hard in a second wave of COVID. This is the UK as of last week. So we're getting close to having 50,000 deaths attributed to COVID. Now, you have to be quite careful with this data. These are deaths where the patient, the person dying, has had a COVID positive death within the previous 28 days. So it may not be, strictly speaking, COVID related deaths, but they've had COVID and that potentially has contributed to death. So it's a significant number of cases, a significant number of daily deaths. We're running infection rates around the 25,000 a day positive tests at the moment. And this is the biggest concern. If you talk to our hospitals in London and around the country, and particularly in the northwest at the moment, their intensive care units are filling up. And although we're becoming better at treating COVID-19, people are continuing to die. And this is the kind of 7-day graph of comparing what it was like back at the peak in May and where we are at the moment. And we're heading in the same direction. There's a bit of evidence that we may be flattening that curve a bit. But ultimately what that's resulted in is lockdown. And like many countries across Europe, Scandinavia, Netherlands, Belgium, France, Italy, Spain, all these countries are in some form of lockdown at the moment. What does it mean for us in the UK? We have a lockdown where I'm at home this morning. I'm allowed to go out of my house to the shop. Only the supermarkets are open. There are no other retail stores open. I'm allowed to go out of the house to exercise, and our schools are open, but that's it. Our offices are closed. We're all encouraged to work from home, and this is for a set period of 1 month. And if the numbers don't turn around, then we may end up extending that. But this is a similar story across Europe at the moment. So, how's the travel and tourism business reacted to COVID-19, and what is the industry in travel and tourism doing to kind of deal with this? And I thought I'd share some examples of what's going on, some lessons from globally and parts of the world. In terms of travel, there is a whole bunch of certifications and standards that have been developed to try and convince people that it is safe to travel and that destinations, countries, regions are safe places to go. And safety is a real key theme of what you need to focus on post-COVID. So here we have the Safe Travel stamp from the World Travel and Tourism Council, a series of protocols, a kind of simple certification that a destination can gain, and a large number of destinations around the world have applied this. We then have regional programs. So this Healthier, Safer Tourism program is one that's been developed within the Caribbean islands, because obviously their economy is severely threatened by this. Let me just go back. And on the right here, we have a country initiative, and this is the Healthy Tourism certification that Turkey is using to say that its hotels, its accommodation providers are healthy places to stay. So we have a number of travel and tourism certifications that have appeared. It's not just in terms of hotels and accommodation. There is now an airport accreditation scheme, which is saying this airport is a safe place to travel through. And we have an interesting initiative by the World Economic Forum. And this is to try and overcome the problem of, if you're traveling from one country to another, how do you prove that you are COVID safe, that you don't have an infection currently? And what they're trying to develop is an app which kind of embraces the various tests, which will become an international standard called Common Pass, which effectively is providing evidence of your COVID status. The other thing, of course, is that we have hospital certifications appearing from TMOS, the German-based certification company, and from a US provider, that are effectively enabling a hospital or clinic to say, we follow COVID-safe protocols and we are COVID safe. And then, again, this is worth thinking of for Seoul or for Korea. some of the major medical tourism destinations, and this is Dubai Health Authority, who have introduced a program of non-COVID hospitals, of saying, right, there are some hospitals in Dubai that are completely COVID safe, and they will remain non-COVID hospitals, and they will not admit any patients who have a COVID infection, which enables them to continue the treatment of others. What about insurance? So the issue is, if you're traveling, what happens if you get COVID-19 while you're traveling? Well, here's an initiative that's been introduced recently in Singapore, and this is a low-cost travel insurance product which covers people visiting Singapore for any risk of catching COVID-19 and the potential costs of treatment. Again, out of Dubai, this is Emirates Airline, and what they're doing to encourage the opening of Dubai as a destination is anyone who books a flight with Emirates Airline receives a free travel insurance program product, which covers them for the complications of COVID-19. So they're saying to people who want to travel, look, we will give you the insurance that will cover the cost and any issues that may arise. So how's COVID affecting health provision in hospitals and clinics across the globe? Well, what it's really done, if we look at the cost of providing COVID-safe environments in hospitals, the added cost of PPE, personal protective equipment, and so on. It's adding to the time that it takes to treat patients and undertake operations, and obviously massively increasing the cost in some cases. That ultimately, and we've seen this across the UK, that there is less theatre time to treat patients in general. So we estimate in the UK that the amount of operating theatre time within our operating theatres across the public and the private sector is 20% less than it was pre-COVID, because of the time it's taking to set up for operations and then clean down and sterilise again after operations. And ultimately, fewer beds, because beds are being taken up and occupied with patients with this disease, and other patients not being able to get into those beds. What does that all mean? It results very simply in pent-up demand, and this is our UK data. So we have a public health service, we have a national health service, and there are stipulated waiting times that the government says normally you should not wait more than 18 weeks for any operation. So that's the maximum waiting time. Well, here's the data for July 2019, July 20. The number of patients exceeding that statutory limit has increased fivefold. The number of patients waiting more than a year for a scheduled operation has gone up 80-fold. I was watching a BBC documentary last night about a London hospital, a major teaching hospital, where, you know, they've during the period of the COVID peak, they were unable to undertake any regular operations because they were just blocked out with COVID patients. So, and this is not only happening in the UK, this is happening in many countries around the world, that you have this massive pent up demand for treatment. And certainly what we're seeing in the UK is that, particularly where the public sector can't cope, is we're seeing a growth in private health insurance and in people paying out of their own pockets, out of their savings, to have operations that they need. How's it affecting patient flow? I'm just going to share some data. We did a survey of 250 people around the world involved in this business back in March, April, and just their view of what the impact, they thought the impact of COVID-19 was going to be. We obviously asked them, what's it done to your patient numbers? And the impact on medical travel, the flow of international patients has been massive, and this is everywhere, that travel stopped, international patient just didn't arrive. So, generally their business is down 50, 60, 70, 80, 100%, complete virtual disappearance of their international patient business. We asked these people, well, how long do you think it's going to take till we get back to normal? So we asked this question back in March, and they're saying, well, it's going to take 6 to 12 months to recover. Well, hang on, we've got to the 6-month point and we're still nowhere near recovery. So add another 6 to 12 months for now, and the outlook is very, very long term. We asked them what they were doing about staffing, and the general view is most international patient departments or clinics that are focused on international business are cutting staff. So they're either laying them off, they're putting them on a furlough, or they're reducing working hours. And the problem now for many of those hospitals and clinics is deciding, well, what do we do? Do we keep them on for another 6 months, paying them without actually any real work to do, or do we lay them off permanently? How's it changing patient perception? What people felt about this was that, in effect, it was going to increase the time that patients were going to take to make a decision about medical travel. So patient concerns about safety were going to extend their decision-making time. So it's going to take longer to convert an inquiry into a patient. Converting interest into an inquiry, into a booking, is going to be much harder. We also asked about distance. Were patients going to be prepared to travel as far? And it's clear that the view is patients just won't travel as far. They may drive across a border rather than fly any significant distance. So patients are not going to travel as far. Cultural match is going to become even more important than it was before. And that's all about this trust and safety thing. Do I feel safe in this environment? And I think it really does prompt you, and it should prompt you to really think about your markets and where your business will come from in the coming months, or certainly once we've got back to some kind of normality. What about influence on patient choice of medical package? Well, really, we're through 3 things here. They're really going to look at established brands, people they can trust, that word again, destinations that have beaten COVID-19, and destinations that are perceived as COVID safe. So who's the winner? So in this kind of nightmare world that we live in at the moment, are there any countries that are actually potentially going to do better than this? And I have to say, the winner in this is, or certainly one of the winners out of others' pain, is probably Korea. And I think you need to think about why you sell Korea and how you would promote and sell Korean healthcare post-COVID. And really think about possibly a new message. This is what the world thinks of Korea over the last few months. You could not want for a better PR story. Look at some of these headlines. Every word about Korea, South Korea, is about success. The secret behind South Korea's COVID success, leveraging South Korea's COVID-19 success. And this is across Europe, the USA, Asia. Korea has got more coverage in the international and national press in the last 6 months than I think it ever has done before. And these are all very positive, good news stories. How is it changing patient communications? Just a few comments to finish on that. Unquestionably, telehealth is here to stay. Some simple data here, but we know how telehealth and telemedicine, that was once a nice to have, is now a must have. and patients have become used very quickly to interacting. I interact with my local GP using a computer screen. So this is now a must-have. And that's got a really important message for South Korea, because what does your country do better than anywhere else in the world? And it's all this stuff. You know, one of the leaders in technology worldwide, in terms of what you can do both in the general technology area, but also in telehealth and telemedicine. And this is an area that you have a real opportunity to maximize. So for South Korea in medical travel, yes, this COVID-19 bug is a threat, but probably more than any other country in the world, this is an opportunity. So just to conclude, I believe South Korea has enhanced massively its global reputation as a result of COVID-19. You know, I know that you're still fighting it like many other destinations in many countries, but it is at the moment the standout country in terms of managing this and demonstrating the strength of your healthcare system. The advantage you have in technology, given what's happening in telehealth and telemedicine, is a real opportunity for you to build stronger competitive advantage. So my message is there's a lot of pent-up demand up there across many countries for healthcare. You are ideally positioned to take advantage of that. So Seoul, South Korea, exploit the opportunity. Thank you for your time this morning. Thank you, Keenan, for the invitation. Please take a look at IMTJ.com. We publish regular COVID-19 industry updates. It's about all we write at the current moment. Thank you very much.